Hey everyone, this is Dr. Smith with Valhalla Chiropractic, and this is
Allyssa LaScala. I'm a holistic metabolic coach.
And she volunteered to help me explain Graston. Now I know you guys see, if you've seen anybody with those red marks on their neck or their back, and you've kind of been, did someone hit you or something like that? There is a very natural.
Is this a hickey on the side of your neck? That's what
Yes.
someone asked me one time.
So I'm here to explain what the therapy is, why I do it, why patients love it and they come to me for it, and then kind of go from there. So to take it away, I'm going to have Allyssa kind of come to this side. She has some rhomboid issues. She works out a lot, so this has worked really well for her with some scapular issues from doing this all the time. A lot of people with a lot of tension with upper cross where they're doing this, you get all these knots in here. So for people that have a lot of scar tissue, this is a chronic issue for them. Graston is a great thing to try. So I'm gonna have come over here, and then for you it's mostly right in here. Yep. So these are your rhomboids, just to go a little bit on that anatomy. Rhomboids, a lot of rotary cuff issues are right up in here. Infraspinatus, a lot of lat issues. So if I was to kind of globally hit this with Graston, I would do the entire shoulder. Again, upper cross, you're leaning forward. You're gonna have tight muscles up in here. Supraspinatus is your rotary cuff muscle. If you can't get your arm up all the way, that's this guy right here. For today, we're gonna do this. So as you can see, no red marks in here. This is just aloe. Nothing special. And then I'm gonna have, go across your arm. Perfect, and then you're gonna bar it with the other arm.
Okay.
So we're gonna really stretch that out. And then I'm just gonna glide this along the muscle. And I'll always ask, hey look, does that feel really tender in that spot? What I'm looking for is bright redness. So as I'm doing this, I might start to see areas of what I call Tiki Eye, and that's superficial capillaries kind of bursting, which is caused by kind of scar tissue formation. And you might see,
Ooh, yeah.
I don't know if you can see this, can you see that red spot kind of forming right there? So she's got some issues right there, but I did the same pressure all along her rhomboids, but only right there is kind of showing up. So that tells me that she is going to have pain there. 100% of the time, you're going to have pain in an area that I find redness like that. So we focus on that area. Again, it is a stripping of the muscle, but I'm lengthening it, and as it heals, throughout the next couple days, it's going to be longer, and it's not going to feel that that tension in there. So she's got another one up here. This is her Levator Scap, which is another very common area, and the insertion point to that. So, and a little bit of rhomboids down in here. So that's just a quick example. I would do a little bit more, and if I was doing the entire shoulder, obviously I'd kind of hit all that parts, retest it, see what the range of motion is. If you feel like, man, that just feels so much looser, I did my job. Very important, afterwards, this is gonna be sore the first time you ever get it. I am not expecting it to get that red after a couple treatments of that. When I do this and I still get that, that means it needs a treatment. Biofreeze, some kind of ice afterwards to kind of cool it down. Again, I'm looking for looseness in the muscle and better range of motion. Range of motion for the shoulder would be coming up all the way or coming across your body. A guarding position for the shoulder is coming up and rounding that arm forward like so. That's why some of the stretches are trying to get that arm back. So that's Graston, everybody. If you have any questions, I'm going to post some links below. Thank you, Allyssa, for being a great example. And
Absolutely. Love it.